Hello everyone. The topic for this session is cranial cavity and dural folds. The objectives are to learn about the cranial cavity and its content, the cerebral dura mater, FALX cerebri, tentorium cerebelli, diaphragma SELLAE, FALX cerebelli, and clinical aspects. The cranial cavity is the highest placed cavity which contains the brain, its coverings, that is the meninges, the dural venous sinuses, all the cranial nerves, the 4 petrosal nerves, parts of internal carotid artery and part of the vertebral artery. It is having the vault and the base. The convex upper wall of the cranial cavity is known as the vault. It is uniform and smooth. So here we can observe the crista galli and the sulcus for superior sagittal sinus. The base of the cranial cavity is uneven and presents 3 cranial fossae: anterior cranial fossa, middle cranial fossa and the posterior cranial fossa. So other few parts which is related to this topic we will see, that is the tuberculum SELLAE, dorsum SELLAE, anterior clinoid process and the posterior clinoid process. The brain is covered by meninges from outside to inside. These are dura mater, that is here we can see the reflection of the dura mater which forms the outer covering, then arachnoid mater and the pia mater. So in this diagram we can see the layers of dura mater, arachnoid and the pia mater. So dura mater, it is the outermost and thickest membrane. Dura means the tough. So it is a toughest membrane that covers the brain. It's having 2 layers, the outer endosteal layer and the inner meningeal layer. The endosteal layer, it is also known as endocranium. It is continuous with the periosteum lining the outer aspect of the skull through the sutures and foramina, and also it is continuous with the periosteal lining of the orbit through the superior orbital fissure. It provides the sheaths for the cranial nerves. Over the optic nerve, the dura forms a sheath which becomes continuous with the sclera, and its outer surface is adherent to the inner surface of the cranial bones by fibrous and vascular processes. The adhesions are more marked at the sutures, base of the skull and around the foramen magnum. So the inner layer is the meningeal layer. It forms a folds that create a septa to subdivide the cranial cavity and stabilize the brain. So the meningeal layer, it forms the different folds. Those are the FALX cerebri that lies between the cerebral hemispheres in longitudinal fissure, the tentorium cerebelli. It lies between the cerebrum and cerebellum in transverse fissure. FALX cerebelli, it lies between the cerebellar hemispheres, and the diaphragma SELLAE, that is lining the sella turcica or the pituitary fossa. So the 4 folds of the meningeal layer of the dura includes the FALX cerebri, tentorium cerebelli, FALX cerebelli and diaphragma SELLAE. So one by one we will observe their attachment and the sinuses related to it. The FALX cerebri, it is sickle shaped fold and it is large, and it occupies the median longitudinal fissure between the cerebral hemisphere. It is having two ends, the anterior end and the posterior end. The anterior end is narrow and attached to crista galli. The posterior end is broad and it is attached along the median plane to the upper surface of the tentorium cerebelli. It is having two margins. The upper margin, it is convex and attached to the lips of the sagittal sulcus. So in the beginning I have shown the margins of the sagittal sulcus in the vault. So it is attached to that sagittal sulcus. The lower margin is concave and it is free. The surfaces, it is also having two surfaces, right and left, and it is related to the medial surface of the corresponding cerebral hemisphere. The sinuses related to the FALX cerebri are superior sagittal sinus, the inferior sagittal sinus and the straight sinus. The superior sagittal sinus will be related to the upper margin. The inferior sagittal sinus runs along the lower border, and the straight sinus is related to the base of the FALX cerebri along the median line or above the tentorium cerebelli. So next is the tentorium cerebelli. It is tent shaped and it forms the roof of the posterior cranial fossa and separates the cerebellum from the occipital lobes of the cerebrum. And it divides the cranial cavity into two, that is supratentorial above the tentorium cerebelli and the infratentorial compartment below the tentorium cerebelli. So it is having two margins, the free margin which is U-shaped and the attached margin. The anterior margin is U-shaped and the ends of U are attached anteriorly to the anterior clinoid processes. Bounds the tentorial notch which is occupied by the midbrain and anterior part of the superior vermis. The outer margin or the attached margin is convex. The posterolaterally it is attached to the lips of the transverse sulci on the occipital bone and the posterior-inferior angle of the parietal bone. Anterolaterally, it is attached to the superior border of the petrous temporal bone and the posterior clinoid processes. The free and attached margins cross each other near the apex of the petrous temporal bone. The triangular area anterior to this point is pierced by third and fourth cranial nerves. The tentorium cerebelli is having two surfaces, the superior surface and inferior surface. The superior surface is convex and slopes to either side from the median plane. The FALX cerebri is attached to this surface along the median plane and it is related to the occipital lobes of the cerebrum. The inferior surface, it is concave. The FALX cerebelli is attached to its posterior part and it fits the convex superior surface of the cerebellum. So the concavity of the inferior surface fits the convex superior surface of the cerebellum. So the sinus related to this dura mater are superior petrosal sinus along the upper margin of the petrous part of temporal bone, and the right and the left transverse sinuses. The straight sinus, it is present along the median line, which is related to the base of the FALX cerebri, and below, that is inferior surface, in the posterior aspect, the occipital sinus is related. FALX cerebelli. It is small sickle shaped fold of dura mater. It projects forwards into the posterior cerebellar notch. The base is attached to the posterior part of inferior surface of the tentorium cerebelli in the median plane, and the apex usually splits into two, and it lies on the sides of the foramen magnum. It's having two margins, the anterior and the posterior margin. The anterior margin is concave and free, whereas the posterior margin is convex and is attached to the internal occipital crest. The occipital sinus is related to this fold. Next is diaphragma sellae. It is a small circular and horizontal fold of dura mater. It forms the roof of the hypophyseal fossa. Anteriorly, it is attached to the tuberculum sellae. Posteriorly, it is attached to the dorsum sellae. And on each side, it is continuous with the dura mater of the middle cranial fossa. It has a central aperture through which the stalk of the hypophysis cerebri passes. So in this diagram, we can see the pituitary gland in the pituitary fossa and its stalk piercing the diaphragma sellae. Blood supply. The outer layer has a rich blood supply, and the inner meningeal layer is more fibrous and it requires less blood supply. So the vault or the supratentorial space is supplied by the middle meningeal artery, the meningeal branch of ethmoidal artery, and the meningeal branch of the ascending pharyngeal artery. The middle cranial fossa is supplied by middle meningeal artery, the accessory meningeal artery, and the internal carotid arteries, and the meningeal branch of ascending pharyngeal artery. The posterior cranial fossa is supplied by the posterior meningeal branch of ascending pharyngeal artery, the meningeal branch of vertebral artery, the ascending pharyngeal artery, and the occipital artery. Nerve supply. It is supplied by the anterior meningeal branch of anterior ethmoidal nerve, the meningeal branch of maxillary nerve, anterior ethmoidal nerve, the nervus spinosum or the meningeal branch of mandibular nerve, the tentorial nerves, that is recurrent meningeal branch of ophthalmic nerve, then C2 and C3 fibers distributed by 12th cranial nerve, and the C2 fibers distributed by the 10th cranial nerve. Clinical aspect. The pain sensitive intracranial structures are the cranial venous sinuses and their tributaries from the surface of the brain, dural arteries, the dural floor of anterior and posterior cranial fossae, arteries at the base of the brain. The extradural hemorrhage and subdural hemorrhage both are common. The distinguishing feature between the extradural and the subdural hemorrhage are, the extradural hemorrhage is due to arterial reason, due to the injury to the middle meningeal artery, whereas the subdural hemorrhage is venous in nature. The symptoms of cerebral compressions are more late in extradural hemorrhage, whereas it is early in subdural hemorrhage. Paralysis first appears in the face and then it spreads to the lower parts of the body in case of extradural hemorrhage, whereas in subdural hemorrhage the paralysis is episode, that is, it don't have any sequence. There is no blood in the CSF in case of extradural hemorrhage, whereas the blood in the CF is a common feature in case of subdural hemorrhage. So extradural hematoma, that is rupture of the middle meningeal artery by fracture of the inner table of the bone, results in this extradural hematoma. So under pressure, the blood progressively separates the dura from the bone. So the CT image of the extradural hematoma will be like this. So here we can observe the extradural hematoma, and we can also observe the deviated FALX cerebri. So the questions for assignment: mention the dural folds, explain in detail FALX cerebri. Venous sinuses present in relation to FALX cerebri. Tentorium cerebelli. Blood supply of dura mater. The nerve supply of dura mater. Thank you.